I am pleased to rise today in support of Senator Poirier's amendment on raising the age of access to marijuana to 21. Frankly, honourable senators, the fact is this: setting a minimum age of 18 will not protect young people. There are very serious mental health implications for teenagers and young adults consuming marijuana, and we have an obligation as parliamentarians to protect vulnerable populations, which includes youth. At the very least, we should do no harm to them with the laws that we pass in this honourable place. Even though we generally view 18 to 20-year-olds as adults under the law, the fact remains that marijuana has detrimental impacts on the developing brains of youth, which don't reach maturity until around age 25. While the argument might be made about the emotional maturity and awareness of young adults in this age group, we cannot deny science, honourable senators. Experts have been very clear on this. Medical professionals have testified that increased marijuana use before the age of 25 increases one's risk of developing mental illnesses by up to 30% over those who had not used marijuana. And the earlier youth begin consuming, the higher the risks. There is a strong association between daily marijuana use and depression in young people. The Canadian Medical Association has stated that the risk of dependence on marijuana almost doubles when marijuana use starts in adolescence. The Canadian Pediatric Society found that the risk of developing schizophrenia is doubled in heavy cannabis users, and schizophrenia is a mental illness that often begins in late adolescence or early adulthood. Consuming marijuana can also contribute to the onset of psychosis in some youth. During our study on Bill C-45, the Senate Legal Committee heard from Dr. Karine Aguarta of the Association des Médecins Psychiatres du Québec. She had this to say about marijuana use and its impact on young people. Quote, THC is the substance that provokes psychosis, and that will cause schizophrenia to appear 2.7 years earlier among those who consume it. THC worsens the prognosis, quote. Dr. Aguarta indicated that it is difficult to predict which adolescent or young person will be affected. Quote, the problem is that it's like Russian roulette, because we don't know in which adolescents the consumption of even a single joint will trigger psychosis. Others may be able to smoke daily for 2 or 3 years before they develop paranoia or hallucinations, etc. But for certain people, a single joint will trigger all of that, quote. She went on to say, quote, in terms of the function of the brain, we know that the memory and concentration are less. How it creates psychosis, we don't yet know. We don't know in whom it will create psychosis. We do know that on average, people who smoked once in their lifetime have a 40% increased risk of developing psychosis. People who smoke regularly and often in high quantities have a 390% risk, or a 4 times risk, of developing psychosis, quote. Because of the effects of marijuana on the developing adolescent brain, both the Canadian Psychiatric Association and the Canadian Medical Association recommended placing the age of access to marijuana at 21, with restrictions on THC potency and quantity for those under the age of 25. The age of 21 is a compromise. One advantage I see in raising the age to 21 is that it would limit some access to marijuana of kids that are in high school. 16 and 17-year-old kids are more likely to hang out with 18-year-olds rather than 21-year-olds. A huge number of 18-year-old youth are students in Canadian high schools. In fact, I asked Health Canada officials when they appeared before the Senate Legal Committee how many 18-year-olds are still in high school. Their eventual written answer was based on information from Statistics Canada, and they stated, quote, just over 4.75 million students are in regular programs in public elementary and secondary schools in 2015-2016. Of that number, 71,886 were 18 years old, quote. That sounded like a surprisingly low number out of 4.75 million students, so I took a closer look at those numbers. Then the reason for the low number was clear. The data was collected in September of that year, when the vast majority of grade 12 students would still be 17. If that survey was done in June for grade 12 students, how many 18-year-olds would be in high school then? Honourable colleagues, I'm certain that number would be in the hundreds of thousands. By leaving the age at 18, the federal government is effectively telling all those 18-year-old high school students that it's perfectly okay for them to use marijuana, and they are essentially putting that product directly into a high school environment. What message does that send to younger kids in that same school? If their 18-year-old friends can do it legally and can socially share it with them, it must be okay, right? Obviously, we would have much less of these problems if the age for accessing marijuana was 21. Clearly, almost all 21-year-olds are out of high school. Likely, most of their friends would be too. It would be a better natural dividing line between kids in high school and young adults. Honourable Senators, please also note that in every single U.S. state where marijuana is legal, the minimum age for access is 21. I know that the federal government talking points on raising the age limit is that provinces are permitted to raise the age limit as they prefer. It must be at least 18 across the country, but the age for access might be higher in some provinces, as with alcohol. What is the outcome for differing ages on alcohol between regions, Honourable Senators? A patchwork application of ages in different provinces will mean that once again, some provinces of the country will see the movement of marijuana over provincial borders in order to access marijuana in provinces with an age of 18. We often see this happen right here in Ottawa, where 18-year-olds traipse across the very nearby provincial border, steps from Parliament Hill, to purchase alcohol from Quebec, where the drinking age is 18. It is hardly a stretch of one's imagination to consider that similar circumstances would result with marijuana. I know that some of you may view marijuana as no big deal. Kids are going to smoke it anyways. We might as well make sure that they do it safely, whatever that means. Yes, they probably are. But we, as the adults in their world, don't have to condone it for them. We don't have to just give up and give in, and we don't have to allow it legally into their high schools. What kind of message does that send to kids? It reinforces all the myths about marijuana not being harmful or addictive. If it's no big deal, maybe it's no big deal to smoke up and drive either. Lots of people, kids included, believe marijuana doesn't affect their driving, but of course we've seen the repercussions of that in accident statistics. It is a myth that marijuana is not harmful, Honourable Senators, particularly to young people. Marijuana has real and negative impacts on developing young brains, and it can have lasting mental health repercussions. Given all the work I have done for mental health advocacy in Canada over the last several years, I cannot condone any measures that would make it more easily accessible to kids based on that alone. And Bill C-45 will make it easier for kids to access marijuana. It will mean they can get it from their 18-year-old friends or siblings who can now buy it legally. If the social sharing provisions passed at Social Affairs Committee are maintained, those friends and parents can share it with them with lesser consequences. Their parents and siblings are now legally allowed to grow 4 plants in their own homes. You can't tell me that these provisions are going to keep marijuana out of the hands of kids. If anything, these legalization measures will make marijuana more widespread among adolescents, especially when you consider that legalizing it in the first place is understood by kids as tacit approval. Honourable Senators, it's all well and good to post tweets about mental health once or twice a year on social media, or to participate in glossy communications campaigns encouraging those suffering with mental health issues. But this, right here, is where the rubber hits the road. You either stand on the side of protecting kids' mental health, or you don't. As a senator right now, you have the opportunity to keep kids from something that puts their mental health at incredible risk. Please join me in supporting Senator Poirier's amendment to raise the age of access to marijuana to 21. Let's keep marijuana out of our high schools and keep Canada's young people safer. Thank you.